My name is Armando Suarez Del Real. I work for the City of West Allis Fire Department. I am the Deputy Chief in charge of the Bureaus of Fire Prevention and Mobile Integrated Healthcare. I oversee the operations and the administrative side of both of those bureaus and report obviously to the AC and of the Community Risk Reduction Division. We try to keep our community as safe as we can. I think the reason that we started our MIH team is probably the same as with a lot of communities. Our call volume kept on going up. We were seeing a lot of issues with staffing problems where our staffing numbers were going down, our budget wasn't going to change, and so we needed to figure out what we were going to do with the ever-increasing call volume. And that's when we took the model of community paramedicine that's aimed at rural departments, and we employed their tactics to target our high utilizer groups, our patients that are seeing 911 more than 3 times in 30 days. And by focusing on those people and putting in front of the resources that are aimed at helping them, we're able to reduce that volume of patients, essentially cutting down on our call volume also, proactively. Our MIH team looks very different today than it did in the beginning. Like I mentioned before, we originally started to combat our high utilizer group. Since then, we've evolved into a lot of different programming. We have 5 areas of concern, and within each of those 5 areas are each standalone programs, everything from OB and early childhood to socioeconomic needs navigation. We'll try to health literacy issues. We look after the social determinants of health, figure out where people are lacking, see what resources that are in our area or available to them, and then put them in front of the resources. We have very successful programs with our fall risk, our substance use disorder, and our high utilization. We have a lot of referral streams also. We have referral sources from hospitals, so fee-for-service contracts with hospitals. We have 2 of those. We are grant funded for our SED program, and we also are in the Coverdell stroke grant where we can see stroke patients from various hospitals throughout our area. Well, one of the nice things about that ImageTrend, how it helps our programming itself, is it's completely customizable. We have control over the reports that we're running, the EPCR templates that we make. So for each of our clients, each of our referral sources, we can make a report that's specific for their needs. We can put questions and data points that they specifically are looking for. So when we give them a copy of the report, when we send them our report, it looks like the reports that they generate. Not only that, but we're able to mine any data points that we want. We have full control over that, and we're able to look at any metrics that we may find necessary or helpful to figure out what our how the strength of the program is doing and where we should be going in the future. That customizable approach or ability is invaluable. We're able to change course and adjust as needed, and then cater to those that we serve by making sure that the reports and the numbers that are coming out is beneficial to them. One of the biggest success stories, actually, I can't take credit for. It's my boss. He had a patient that had been on hospice, and we had been going for end-of-life care. We had been assisting the hospice nurse in health literacy. There was a language barrier, Spanish-speaking only patient, and as we started putting all of our reports together and everything else, we realized that the reports that the patient had been getting were all in English. Well, we were able to translate everything to Spanish, and realizing that the patient was taking their medications wrong. And we helped the patient get on the right path as far as understanding what the regimen of medications are, and that patient's still alive today. And how that relates to our partnership here is that if we didn't have the ability to mine out what data we needed to look at, if we didn't have the ability to understand that this was a Spanish-speaking only person, not that we couldn't tell when we spoke to them, but that paired with the questionnaires from the hospital, we're able to discover that right away. And like I said, the patient's still alive today, so that's a good story. That's a good outcome. Yeah, I think that the MIH program has had a great impact on our floor and our department. It's a complete culture change, right? We went from a very reactive fire department with the lights and sirens and going to responding to 911 calls to proactively searching out issues that are going to potentially be an issue for our citizens and our community, and then addressing them before they become an emergency. And that approach has greatly reduced our call volume, or at least reduced the rate of rise of our call volume. And it's given some ownership and some pride to our members that they're not only doing a good job in reactionary times, but proactively they're making a huge difference in the lives of the citizens that they serve, and that's a point of pride. We're recognized by a lot of different agencies in our area and nationally, and that's something to hang your hat on. That you're doing something right. You're doing something that isn't normally being done, and being looked at as a pioneer. So it's nice. The best advice that I could give somebody that is trying to get a community paramedic program up off the ground is to understand that there is nothing wrong with researching the different programs and partnerships that are going on across the world. I have never been accused of original thought, right? I've never thought of anything on my own. I've researched it, reached out, looked at, called different departments, asked them how they get a hold of their data, what are they doing, and taking this and that from all these other programs and making them ours is what's worked the best. And then networking, right? So you have to be able to share what it is that you're doing and be vulnerable enough to assess what your progress is, so that you can understand how to correct course. We follow the National Fire Academy program development very closely, their programming development that they have. So that paired with, just getting out there and making yourself vulnerable, it's the Wild West. There's hundreds of years of data and tradition with reactive EMS and public service. It's a Wild West right now. You can shape your own future, but as long as you're doing it in the best interest of your community. One of the directions that we're looking to move forward to, or at least our next chapter, is consolidating some of our other programming with ImageTrend, streamline everything through there with the use of Continuum, and getting our fire inspection and our fire prevention efforts on there, having our CAD go through there, having our dispatching go through there. The ability, I can't stress more the benefit of having the ability to control everything, every report that you're making, and being able to mine any data that you want, and putting everything on one platform would be wildly beneficial. That would cut down on a lot of different reports that we'd have to run. It would cut down on the need to understand all these different technological platforms, and that's where I think we are going to be going in the future.